health experts say the ability to broadly test for COVID-19 is key to lifting economic restrictions. Senator Carla Nelson has authored a bill to provide funding for test development.
You have introduced a bill that would provide grant money for COVID-19 research into tests to detect the COVID-19 virus. Who will receive these grants?
Sure. Well, let me first say it's a little broader than just detecting the virus. It also includes testing for that all-important serologic antibody testing. So both the diagnostic testing, molecular diagnostic testing, and the antibody testing, those are the things that are needed to get people back to work quickly and safely. And the bill is written such that it would be a grant process, and those who are eligible would need to be able to do both of the research, the implementation of the tests that I described that are really going to help get people back to work, and also do so in a way that they have all of the experts on hand to do that well, and that they be a national center for this type of testing. It is so essential that we make sure that the testing is not only efficiently done, but effective as well.
Now, the Mayo Clinic comes to mind, so does the University of Minnesota, but I assume there are other groups that could get this funding?
Well, I don't know what, I can't speak to other groups being eligible. Certainly the bill that I have put forth has these very specific things for eligibility, which gets to the quality that I spoke of, and also the ability to implement quickly.
So as I looked at the bill, there was a fairly long list of the types of tests to be developed. So there's rapid response, there's quantitative droplets, there's the serologic test that you mentioned, and I could go on. Is the intent to sort of spark innovation and providing lots of options in terms of getting that testing out that we need?
Well, to the first part, innovation is always good, but my goal is to basically get out the best research that we have, get it out quickly, make sure it's effective, efficient, and we get the results that we need so that Minnesotans can get back to work quickly and safely. And it's going to require this high level of testing. Both Mayo and the U can do 10,000 tests a day. This is essential because this virus is going to be with us for a while. But we have to be able to live with the world that we are in now, the COVID-19 world, and it's going to require this kind of testing. And anyone that is eligible, certainly we want them to be able to do that rapid, effective, efficient testing.
No doubt that all sorts of research entities are trying to come up with a reliable, quick test. Is state funding, is this kind of incentive necessary? And if so, presumably it is $20 million enough?
Oh, it's a good question. Certainly the funding is necessary, both for the startup costs, for getting the reagents, the ingredients that are going to make this possible. But I don't know if 20 million is enough. I can tell you the 20 million that I'm asking for is enough. Mayo is asking for 20 million, as is the University of Minnesota asking for 20 million as well. Now, Senator Benson has a grant that I think looks more like, particularly perhaps what the U is looking at, although I couldn't speak to that for sure. But what I would say is, you know, the feds have already sent $1.1 billion to Minnesota. It's sitting in MMB right now. There's another $1.1 billion coming. The state legislature has already appropriated $200 million to the governor for his COVID-19 response, and other $300 million to our hospitals and such. So I would say that the money is there. We just need to get it out the door so it can be put to effective use here.
And to find that test that can help everybody go back to hopefully a more normal. Yes?
Yes, and that, I mean, the antibody test is proven to work, and it's also then being used for that serologic, for that convalescent therapy, that treatment therapy. So people who have antibodies in their plasma then that is able to help those who recover more quickly from COVID-19. So I think we do have the tools. We just need to be able to execute them on a large scale.
Senator Nelson, I want to thank you so much for taking the time today.
Thank you, Shannon.